My name's Ken Lowndes. I'm an advocate for patient safety and zero harm in particular. I'd like to welcome you to this series of 7 short videos which explain zero harm and what I believe needs to be done to get there. The package I call Zero Harm Healthcare was originally put together and given to the Labour government 4 years ago, and then was at the heart of the Cure the NHS blueprint for a new NHS, their recommendations to the Mid-Staff's public inquiry. Those recommendations drove David Cameron's response to the public inquiry report on the 6th of February this year, which put zero harm at the top of the agenda. The objective of Zero Harm Healthcare is just that: eliminating harm to patients during care and treatment. The background is far too many excess deaths across the NHS, far too many errors which cause serious harm or death, far too many complaints. Zero Harm Healthcare tackles this with a system to bring safety science and quality control to form the basis for everything the NHS does, and a standardisation of practices and procedures to enable NHS staff to deliver zero harm to every patient and to give them only the highest standards of care and treatment, and to do it right first time. In fact, to eliminate the current variability in standards. I very much hope that the way of implementing zero harm healthcare, which I describe here, will be the way it's done across the NHS very soon. Harm is any injury, worsening of any existing condition, or introduction of any new condition caused by negligence or willful misconduct during the delivery of care or treatment. I can define it more specifically using examples from the disaster at Mid-Staff's Hospital. First, there was the deliberate physical, verbal and mental abuse and mistreatment of patients that always causes harm. Those types of harm are always avoidable and easy to eradicate. Second, there was a large number of instances of staff refusing to give patients food and liquids, refusing to give them pain relief or medication, refusing to help them to get to the toilet, or not washing them. Again, these acts always cause harm, are always unacceptable, and always avoidable. These 2 types of harm usually apply to the care rather than the clinical treatment of the patient. Patients absolutely must always be given only the highest standards of dignity and respect. Third, there were many instances of harm caused solely by the negligence of staff, by the negligence of their colleagues or superiors, in fact often by the organisation as a whole. These errors occurred in the care and the treatment of many patients. In fact, even in an organisation fully committed to the safety of its patients, there can still be chaos and confusion, errors and harm. The answer to the first type of harm, deliberate harm, is easy. Staff who are capable of such appalling inhumanity can't be allowed anywhere near patients. And I hope that in future the NHS will employ only staff fully committed to the safety of their patients. It's up to management to ensure that staff who can't treat patients properly are not recruited in the first place. But if they slip through the net, staff on the front line must act, must challenge and report abuse and mistreatment of patients, and support the disciplinary process, which should mean dismissal if appropriate. So the Mid-Staff's disaster must never be repeated. Zero Harm Healthcare is the way to achieve that. I'm a member of the public, a campaigner for safe healthcare, and sometime patient as well. And my own experience of losing a loved one to disastrous NH care is now many years ago, but the pain of losing my mother to hospital negligence still hurts. What I've done is to draw together some well-tried and tested and proven practices from other sectors and moulded them together so that they will help in healthcare. Certain areas have been defined as never events for some years now, but they still happen. In Zero Harm Healthcare, everything is a never event. Instead of saying you're going to reduce levels of harm, for instance pressure ulcers, zero harm dictates that you eliminate them. They're avoidable, so avoid them. So what am I suggesting? First, we need to standardise safety objectives across the NHS. Zero harm, right first time. Without one common understanding of where we're all going, we'll never get to the same place. To that standardisation, we need to add standardisation of safety practices across the NHS and use one common, easily understood, easily applied language of safety. All of this can all be gathered together as a safety management system. This new way of working will need to be accepted, owned and adopted by every single person working in the NHS. It won't work if it's adopted only in patches or in small initiatives. Second, we need a similar system to enable us to standardise the standards of care and treatment, which should always be the highest, of course. This is the quality of what the patient receives. Those are the technical elements of zero harm healthcare. Equally important, if not more important, is a set of behaviours I call the zero harm behaviours. In my second video, I'll explain more about both parts of zero harm.